Good morning and welcome to the Tennessee Justice Center presentation on long-term services and supports. This webinar will be no more than an hour, but we'll probably be able to give you a few minutes of your day back because I tend to talk a little fast. If you have questions during the presentation, we're going to ask that you ask your questions using the Q&A box, and we will take those questions at the end. We will send the recordings and slides to you via the email that you registered. If you want to join us for future events, please check our website, tennesseejustice.org/events. We have upcoming trainings in May on the Choices program, in September on ECF Choices, and in November on Katie Beckett. So I'm Emily Jenkins, and I'm a staff attorney here at TJC. I'm joined by Carolyn Springer. She's the Melkus Fellow and a client advocate here at TJC. Our agenda today, we're going to start looking with a little bit of overview about who the Tennessee Justice Center is, a brief overview of the TennCare program, and then we'll get into a discussion of the various long-term service and support programs, how to apply, and what to do if you face loss of enrollment or an adverse action. The Tennessee Justice Center is a nonprofit law firm that offers direct services. We do individual client representation to promote enrollment in healthcare and nutrition programs, what you would know as TennCare or SNAP or WIC. We also do impact work. Our direct service work informs our impact work to advocate for change through class action litigation or legislative or administrative changes. One example of our impact work is advocating for paying family caregivers. We're working in partnership with the Tennessee Disability Coalition and Family Voices to help families get financial relief for the care they may need to provide for their loved ones who are older or who have disabilities. If you're interested in learning more about our advocacy efforts for paid family caregivers, we can connect you with our Health Policy Director, Vanessa Zapata. Another example of our impact work in the advocacy space is the Elderly Simplified Application Project, also known as ESAP for SNAP. Seniors are food insecure in our state because of the many barriers to the program. We provide direct services in SNAP for older adults, but we also advocate for our state to opt into ESAP to make it easier for older adults and adults with disabilities to access SNAP. If you are interested, we can connect you with our nutrition director, Signe Anderson. We're going to begin with TennCare 101. TennCare is Tennessee's Medicaid program. It provides free health care to mostly low-income pregnant women, parents, or caretakers of a minor child, children, and individuals who are elderly or have a disability. To get Medicaid, you must meet the income and resource limits. And just as an aside here, this is one of the things that I think is confusing, at least it was to me when I first started learning about TennCare and Medicaid, is that you'll hear those terms interchangeably because you can think of TennCare as being Tennessee's brand of Medicaid. So when people say TennCare, they're referring to the Medicaid program. Eligibility for TennCare. Eligibility depends on your ability to group. All of the groups have an income test. Some have a resource test, which means the things that you can own, and some have a medical needs test. Some groups that TennCare covers include children under 21, women who are pregnant, parents and caretakers of minor children, individuals with breast or cervical cancer, and people who get SSI or some people who used to get SSI. They get or are eligible for long-term care services that TennCare pays for, which is the LTSS we're going to be talking about today. Now, what does TennCare cover? It depends on the program. If you want to know more about the covered services, you can visit the TennCare website and look at the different benefit packages. We're now going to start talking about long-term services and supports. What does that cover? That depends on what kind of TennCare you have. For dual eligibles, which means folks who have TennCare or Medicare, you can also get benefits like a DSNP, which you may have heard referred to as a dual special needs plan, which includes assistance with out-of-pocket expenses and a food allowance based on which MCO you select. I'm going to back up again here because it's one of those terms that we use that not everybody may understand. Your MCO is essentially your brand of insurance. So you may have Blue Care, you may have WellPoint. That's referred to as your managed care organization or your MCO. For a good overview of services, you can again visit the benefits package on the TennCare website. So when we talk about long-term services and supports, that's also called LTSS. It's administered by the Long-Term Services and Supports Division of TennCare, which is formerly the Long-Term Care Division. You may have heard that term in the past. You can get the LTSS services through various TennCare programs and through waivers. It provides medical and personal care and supportive services for individuals who need help with activities of daily living, which is another acronym they like to use, the ADLs. ADLs are things like bathing, dressing, personal hygiene and grooming, eating, toileting, transfers, and mobility. Supports can also be provided for instrumental activities of daily living, or IADLs. IADLs are things like household chores, meal planning, shopping, preparing and storing food, and personal finance. The LTSS programs are broken down into 4 categories: Choices, Employment and Community First, or ECF Choices, the 1915C Waivers, also known as DID Waivers, and the Katie Beckett Waiver. Each program is used for different reasons. Choices is for individuals who are seniors 65 or older, adults 21 or older with a physical disability who demonstrate a need through a pre-admission evaluation, or a PAE. ECF Choices is for individuals who have an intellectual or developmental disability. The DID waivers are for individuals with intellectual and developmental disabilities who would qualify for placement in an intermediate care facility for individuals with intellectual and developmental disabilities. These are also known as ICF IDD. The Katie Beckett Waiver provides coverage for children under 18 with significant disabilities or medical needs. In the LTS program, Medicaid as a secondary covers your primary copays and deductibles, home health care, and in some cases, private duty nursing. It will cover speech learning pathology, OT, and PT as medically necessary without annual limits. And it covers durable medical equipment that private insurance might not cover. I'm going to briefly describe the 3 DID waivers, or 1915C waivers. These waivers are closed to new enrollment as of July 1st, 2016, with limited exceptions in 2 categories. The comprehensive aggregate cap waiver is only open to former members of a certified class in cases related to the Arlington Development Center, Clover Bottom Development Center, and persons discharged from the Harold Jordan Center following a stay of at least 90 days, as well as individuals transitioned from another statewide waiver in 2015. The self-determination waiver is closed to new enrollment. The statewide waiver is open only to people who are participating in a program run by the state called MFP, or Money Follows the Person. program or who are transitioning from an ICF IID following a stay of at least 90 days. Now, I do want to flag the 1915 waivers because one thing that we're seeing in our work is that people who are on these waivers are having issues being terminated during renewal, because many times the people on the waivers need assistance to understand the letters that are coming to them from TennCare. And so if the letter is sent to the enrollee rather than their assistive person, they may not know what to do and may miss what they're supposed to do to get their renewal to happen. So if you're on a waiver or you're caring for a loved one with a waiver and you have an issue with them being disenrolled during renewal, please reach out to us for assistance. The Katie Beckett program is another program under the LTSS umbrella, and it's a path to supports for children with disabilities that do not qualify for TennCare. There are no income or resource limits, but there are premiums that have to be paid that are income dependent. The Katie Beckett program is divided into 3 groups. Katie Beckett Part A is for children who qualify for care in a medical institution like a hospital or nursing home, but the family wants to care for their child at home instead. Part A serves children with the most significant disabilities or complex medical needs, and the children receive full Medicaid benefits and up to $15,000 a year in home and community supports. Katie Beckett Program Part B is for children with disabilities or complex medical needs who are considered at risk of going into a facility unless they can get services. Children in Part B are not enrolled in Medicaid, and they receive up to $10,000 a year in services. Premium assistance, a health care savings type account, reimbursement for services that will benefit the child but can't be covered under an HSA, self-directed respite and supportive home care services, or an array of services from a community-based provider. Katie Beckett Program Group C. The C stands for continued eligibility, or Part C for short. It's for children who have Medicaid now, but their Medicaid is ending because their parents' income or resources have increased. Part C may allow a child to keep Medicaid if they would qualify to enroll in Part A, but there isn't a slot open for the child right now. We'll tell you more about the slots below. If a child enrolls in Part C and then they get a Part A slot, they must move to Part A. They can't stay in Part C anymore. All of the Katie Beckett groups are numerically capped, so there's a limit on the number of slots in the various groups, and that's why there may be a waiting list to get on Katie Beckett, even if you are approved and meet the other requirements. And if you enter on Part C, you may have to wait for a Part A slot to open. I'm now going to pass the presentation to Caroline, who will talk to you about what the Choices programs involve.
Hi, everybody. My name is Caroline Springer. I'm the Malchus Fellow at Tennessee Justice Center. I'm a client advocate, so I'm working with clients, helping them get on these programs. So I'm going to be talking about Choices, which is sort of my specialty at Tennessee Justice Center. And we're going to go into a deeper dive into what Choices is. Okay, so there are 3 categories of choices. You've got Choices Group 1, Choices Group 2, and Choices Group 3. Choices Groups 1 and 2 are going to have the same medical requirements, but the only difference between them is that for Choices Group 1, you're getting care in a facility like a nursing home. For Choices Group 2, you're going to be getting HCBS, which stands for Home and Community-Based Services. That's typically going to be happening in the home. Both of those programs, Choices 1 and 2, are full-time programs, and then Choices Group 3, sometimes called at-risk choices, is limited HCBS, or limited home and community-based services. That's typically part-time. So you may get an aide or caregiver couple hours, couple days a week. Yeah, and then we also have the 5 categories of ECF choices, which stands for Employment and Community First Choices. This is for folks with intellectual or developmental disabilities, and it offers supports for employment and for folks to be able to integrate into the community. And so we've got ECF choices groups 4, 5, 6, 7, and 8. Some of these groups are for children, some are for adults. Groups 7 and 8 were added more recently, and they are for folks with more severe behavioral support needs. Now I'm going to talk about eligibility for each of these groups. There are 2 parts of the choices application that you're really going to want to focus on. The first one is the medical part, or the PAE test, and then you would move into the financial stage after that. Okay, so who can do your PAE? This is going to depend on whether or not you're already on TennCare. So if you are not on the TennCare Medicaid program, you are going to want to contact your local area agency on aging and disability, or AAAD. You can see on the map on the right that there are local offices for each section of Tennessee. So you would want to contact that agency. There is a main number for all of the agencies, but it's typically easier if you can find the local number. And then if you are already on TennCare, you're going to want to talk to your MCO. So your MCO would be either WellPoint, which used to be called AmeriGroup, Blue Care, or United. You would want to call them and say, I want a PAE test for the Choices program, and they should be able to do a referral for you. There's also some cases where if somebody is in a hospital or in a facility, such as a nursing home, the folks there may be able to do a PAE test as well. So to reiterate, I want to really emphasize this point with the PAE test. If you are on TennCare, you're going to want to reach out to your MCO. So that means WellPoint, Blue Care, or United. If you are not on TennCare, you're going to want to reach out to the Area Agency on Aging and Disability, or AAAD. Those names are going to vary locally a little bit about what your local AAAD office is called. And then the next step would be to complete a PAE test. That stands for Pre-Admission Evaluation. I've got a couple of tips for you for this test. This test, the biggest thing with the PAE test, if you are advising a client on what to say for a PAE test, you're going to want to advise the client to give as many details as you can. So Emily touched earlier on the ADLs, or activities of daily living. So for this test, they're going to be asking you things about walking and mobility, transferring, which means getting in and out of bed, getting in and out of a chair. They're going to be asking about eating, if you can feed yourself. They're going to be asking about toileting, if you're able to go to the bathroom by yourself, getting in and out of the bathroom, if you're able to clean yourself. They're going to ask about communication, if you can effectively communicate your needs to others, if you can effectively understand others, what others are saying to you. And they'll ask about medication, if you're able to take your medication by yourself. So when you're getting this test, a client might get a straightforward question such as, can you get out of bed? And your instinct might be to say, well, yeah, I can get out of bed. But the important thing with the PAE test is to provide as many details as you can to really explain the process. So for that answer, you might want to say, well, yeah, I can get out of bed, but I'm pretty stiff in the morning. It takes me about 45 minutes. I have to lean my hands on the table next to me because I'm a little unsteady and I'm worried about my balance. I'm worried I might fall. So any kind of relevant details like that, you just want to make sure to include those. The other thing that can be really impactful for your PAE test is having someone there with you. So I advise my clients, do you have a caretaker? Do you have someone who lives with you, who sees you every day, who really has a clear understanding of how you're living? Or even just a family member, a friend, really anyone who can be there with you to advocate for you, provide those additional details, especially since a lot of folks with disabilities have gotten used to their disabilities, they've adjusted to their way of life, and they may not always realize, just how challenging life is, and that they may have higher support needs than they may assume. Another thing you can do is ask for a safety determination. This can be really useful if somebody's sort of on the cusp of eligibility and they just need a little bit of extra documentation to really prove that they do need those supports. So you can always ask for a safety determination. That test is going to be essentially evaluating if that person can live safely in their home. If someone gets a score of 5 or higher on the PAE test, it should be automatic, but that can be a good thing to check. And the last thing is you can always ask for a one-on-one, which means that the caseworker should come to the home. And that can be really useful as well for someone who may be on the cusp of eligibility. When someone comes out to the home, they can really get a lot more context for that person's situation, as opposed to all over the phone. Okay, now we're going to continue with the enrollment process. Once somebody has gotten a completed full PAE test, they've gotten their score back, that is typically things tend to move pretty easily from there, depending on how complicated the case is. One thing you really want to make sure of is that a TennCare application has been submitted for that person. And the reason for that is once you've gotten that approved PAE test, you're now moving into the financial stage. So you really want to make sure that TennCare has the updated financial information for this person. And once that is all completed and all submitted, TennCare has 90 days to make a decision. And typically the triple AD will do that application, your MCO could do that application. So you really want to double check if it's a nursing home or a hospital, just to make sure that that application is in, because you don't want to delay your client potentially being able to get on a little bit sooner. And then you will basically move into the waiting stage where they have 90 days. You want to regularly review the TennCare Connect account for any requests for additional information. Choices in particular is a little more complicated with their resource limit. So there's an income limit for 2024, that's $2,849. But I'll be talking a little later about some workarounds for if someone's income is a little too high. And then the resource limit is $2,000, so that's the total value of things that somebody owns, and those can be a little more complicated. So you just want to watch out for any requests for additional information. TennCare might be asking for bank statements, but there are some cases where it might be a little more complicated with life insurance policies and things like that. So if you're having trouble, please give our office a call. We'd be happy to help you out with that. And you can expect that TennCare will ask for financial records because they need proof basically that this person meets the income and resource limit. Okay, now I'm going to touch on QIT or qualified income trust. So once a person has gotten past the PAE test, they are medically eligible for choices. You're now moving into the financial stage. So somebody starting off might not be financially eligible, but they can usually get there if they're close enough. So if your income is a little bit too high, you may want to look into a QIT or qualified income trust. This is a legal document that helps the applicant get around the income limit if their income is a little bit higher. In this case, I just want to define some terms. So we've got beneficiary, that's the applicant or the person applying for choices. And then we have the trustee, who would be the trusted legal representative. That might be a power of attorney. And this would require a separate bank account. So that may be something to look into if it is a workaround if your income is a little bit too high. Resource issues can be a little more complicated. The key thing with resources is if someone owns one car, that's usually fine. If someone owns a home and they live in that home, that should be fine as well. That shouldn't count. But the things that we run into probably most frequently as resource issues are if a savings account is too high, Sometimes commingled bank accounts that have multiple people's money in there, that could be an issue. Life insurance policies with cash value can be a common issue. Additional homes and property are sometimes an issue. So whoever you're working with, whether that's AAAD, your MCO, they should be able to help you submit the appropriate documents or to spend down if necessary. But if you're having continued issues with that, please give us a call. We're happy to help with those sorts of more challenging or tricky issues to make sure that you would meet that $2,000 resource limit. And I'll turn it back over to Emily to talk about how to apply for TennCare.
Thank you, Caroline. So to apply for TennCare, you can go to TennCare Connect, and you'll want to set up your TennCare Connect account, and you can apply online. Once you've filled out an application, there is also a TennCare app you can get for free in the App Store that will allow you to track your application on your phone, but you cannot submit, at this time, you cannot submit an application through the app. I'm going to back up here a minute on the how to apply section. One thing that I want to make sure to point out, because it seems to be an issue that some of our clients get tripped up on, is the question about does anyone in your home need nursing home level of care? This is where you're going to answer yes if you're trying to get long-term services and supports, because what the question is asking is, do you need supports like you would get in a nursing home? It's not asking, do you want to be placed in a nursing home? The way that that question is worded, a lot of people will answer no, because no, you want to stay in your home and get the services there. But that's the question that triggers the understanding that you want to be considered for something like the ECF Choices or the Choices programs. So just make sure when you go to that question that you answer yes if you're trying to get into long-term services and supports. Now, as Caroline mentioned, once you've submitted your application, there will be a period of time where TennCare will consider your application. They may also ask you for additional documents. So when you set up your TennCare Connect account online, it's a good idea to put that you would like to receive email and text messages for updates so that you don't miss any additional information that they're requesting, particularly when you're talking about programs like Choices and ECF Choices that have income and resource limits. They may request additional information about your sources of income. They may request additional information about property that you own, life insurance policies that have cash value, other things that you may not have thought about when you were filling out the application, but they have to have as part of considering your available resources. So you want to be sure once you filled out your application that you continue to check on it in TennCare Connect, and that if you're someone who doesn't use the web, you're not super tech savvy, that if you're getting letters in the mail, that you need to make sure you are opening those letters, that you have an accurate home address on file with TennCare to receive updates, and that any additional information that they ask of you, that you turn it in within the time frame that they've set for response. If you're looking for services for yourself and you maybe have some barriers to understanding those documents, or you need some assistance, you can request to have an assisted person added to your TennCare account. And that person would then also receive the notices. You can set them up to receive the notices about the status of your application, and they can talk to TennCare about any additional information that TennCare is requesting. Now, once you have applied, there are at times adverse actions. This can mean either that TennCare is denying you admission into a program, or if you're already on TennCare, that they are proposing to terminate your coverage. If you have an adverse action, again, you want to be sure that once you get that notice, You're paying attention to any additional documents TennCare is requesting of you, paying attention to the appeal time period that it says in the notice that you have to appeal. And then if you need assistance with an adverse decision, please reach out to us at the Tennessee Justice Center, as we may be able to help. If you're going to file an appeal yourself, you're going to file it on the TennCare website within 30 days of the application denial or the service denial or the termination of your benefits. If it's if your appeal is regarding being turned down based on your PAE, an internal review of the original PAE is going to be conducted by the TennCare Long-Term Services and Supports Division. They may ask for additional information, and if they need more information about your PAE, that will go to the TennCare contractor that performs the PAE evaluations. TennCare will review the results of the final assessment, and if they disagree with your assertion in your appeal, then it may go to a hearing. The hearings are administrative hearings. They're conducted by phone. It consists of a phone call to you at a set time on a set day, where you'll have an opportunity to say the reason why you think the decision is wrong. Again, if you need assistance with an appeal, please reach out to us so we can determine if we may be able to help. We're now going to go to the question and answer session. So it looks like we have a couple of questions. Is it accurate that the intellectual and developmental disabilities for ECF and DID must be diagnosed before the age of 18? I think it's the age of 21.
I think it's the age of 21.
Yes. Okay, question 2. This is such incredible information. I'm barely able to keep up and may have questions. Will this presentation be sent out or shared later? Great job. Okay, yes, we will be sending you out the slides to the email address that you signed up for the presentation on. And then if you have specific questions, again, please feel free to reach out to us. We are a nonprofit firm, and this is what we do, is we help people with their issues with TennCare and SNAP and WIC. So if you have specific questions, you can reach out to us and then we can help you. Okay. Next question, is this person assigned by TennCare or is this person someone? I'm assuming this question is regarding who completes the PAE, and that would be assigned by the Area Aging and Disability Office if you do not currently have TennCare. It would be assigned by your MCO if you already have TennCare. Oh, yes, and Caroline has a.
Let me look at it. Okay, yeah, so for a lot of people don't know about the Choices program or about the LTSS programs in general, but if it's something that someone is even interested in, they can apply. And you can apply as many times as you want. If someone is interested in applying, I would recommend that they go ahead and do that, because they'll just get to see if they're medically eligible or not. So if an individual, has never been on TennCare, but they're looking for some support services, they can go ahead and apply. Yeah.
Okay, we have a question about the renewal that asks if you have an intellectual disability and would like to receive HCBS in ECF Choices. This has been problematic for some of the people in the waiver because they answer yes. For some reason, the question about the waiver that is shown on the resource packet has not been in most of the packets. Services have been terminated when the question about HCBS is yes, because they do not go on to submit the self-referral. These folks are obviously not in the category that would trigger these questions. So how can we identify that a person is receiving these services in the waiver?
That really, I think it would depend if this is a pre-term that you're filling out. This is a pre-termination, where someone has gotten a letter saying your services are going to end, but we want you to fill out this paperwork to see if you're still eligible, or if it's a renewal packet. And we would really go, I think we would really go on a case by case basis with that. You can always write an additional note on any of that paperwork, just saying any information that's relevant. For example, this person is on the ECF category of choices and they would like to remain on that category. But those questions are tricky. And that is a big part of what our casework team is doing, is helping folks, assisting folks with those renewal packets. And you are right to point out that sometimes people run into issues where they don't answer a question quite the way TennCare maybe wants them to, and that could cause problems later. But if you have specific questions about it for a specific client, we'd be happy to take a look.
And if the client is on one of the waivers and that's happened, please reach out to us, because
Yeah.
if you're dealing with somebody who's on the waivers, you know that that's a program that TennCare has been trying to phase out, and they would love to move everybody from the waivers to the choices programs, but the coverage on the waivers is preferred if you can stay on the waiver. So if you have somebody who's been involuntarily terminated from the waiver because of an issue with a question on a renewal packet, please reach out to us, because we want to get their coverage reinstated on the waiver basis if possible. Okay, for people interested in gathering more information about the menu of services for either Choices or ECF, who's the best person to contact their MCO? I would recommend both. I would recommend that you contact your MCO and let them know that you're interested in it, and then they can help you with explaining what the program involves. But also, if you go to the TennCare Long-Term Services and Supports website, there is an explanation page that explains each of the groups of ECF choices and choices. And again, I will say I did not name these programs. I don't know why they had to name them choices and ECF choices. It's very confusing. I wish they had different names, but they don't. But you can click on each program, and then within that, you can see the various groups for choices and ECF choices, and then what the services and supports are for each group, who qualifies for each group, what the cost cap is for each group, and the types of services you can receive for each group. Okay, looks like we've also got questions in the Q&A section. Let's see. Would there be a reason to have a QIT and a third-party trust?
I think that would depend on what type of trust it is. That can get a little complicated. So QIT is only if someone's income is too high, is when you'd want to use that. But I'm not sure a third party. Some people have a special needs trust. It would really, for that, I would want to look holistically at all of the information about this individual.
Yes, like the trust question can get super complex because there's just so many different forms of trust. You can have a life insurance trust that doesn't actually have anything in it until the person dies and the proceeds go into the trust. So that would be very different than a QIT, which is for your income. So trust questions we can provide limited assistance on, but we may be able to refer you to someone if you have a more complex estate planning question.
Answer this one.
Okay.
Okay, this is a great question. Is choices something that can qualify you for TennCare standalone, or do you have to qualify for TennCare and need choices? So, when someone applies for choices, they automatically get TennCare as well. So if someone doesn't qualify for TennCare in another category, choices can be a way that someone would qualify for TennCare. Hopefully that makes sense. You do not need to qualify for another category of TennCare in order to get choices. You would just need to meet the medical and financial requirements for choices, and that would automatically get you TennCare. So they're related, but they're almost like different. Choices is like a whole nother package of benefits and services.
Yeah, and one thing I wanted to raise up that we've seen is particularly for children with disabilities who don't necessarily receive higher level services like home nursing care. If they're on TennCare based on being a child and under the income limits, then they may reach 18 and they age out of TennCare coverage. But if they apply for choices, then that would be their pathway to continuing to have TennCare coverage, even when they age out of the child category, which you're not necessarily going to hear about from your MCO, because if you're receiving services like home nursing supports in excess of adult benefits, then the MCO will say, hey, you're about to not be a child anymore. You're using these services that are more than adult benefits. Let's talk about what your benefits look like when you reach adulthood. But if you are somebody with disabilities who's not requiring a high level of in-home services at the time, you may hit 18, age out of child coverage, and then have to go through the whole application process for choices and face a wait list and a gap in coverage. So if you are caring for a child with disabilities or someone who would have a basis to qualify for choices when they reach adulthood, we would highly recommend that you begin the process of application before they turn 18.
I can answer this one.
Okay, the next question.
Okay, the next one we've got is where can we find information about ECF 4, 5, and 6 eligibility? I would recommend you Google search ECF Choices Tennessee or Employment and Community First Choices Tennessee. You should go to the TennCare, should take you to the TennCare website. And at the bottom of that page, you're gonna see a couple like drop-down menu tabs. At the bottom, there's one called resources, and that second bullet point is going to say member benefit table. And that's a really helpful chart to see what is covered. It'll look, I don't know, you're going to be able to see my screen. No.
And we can send out links to this, I think, also when we send out the slides to the various choices categories. Let's see. Oh, and one thing to mention so the reason it's called ECF Choices is because it's the Employment and Community First Choices program. The idea behind it is that regular, I don't know why I always call it regular choices, but choices, is for people with disabilities, but ECF Choices is intellectual and developmental disabilities before the age of 21. And that it's to give these people a pathway to independence. And so the ECF part is a lot of supports that can help you with job readiness, with identifying potential employers, to help you with if they are working, to help them with supports they may need while they're working. So there's a lot of services on there to help integrate people into the community who have intellectual and developmental disabilities. There is a pending request to add the job supports to the choices 1, 2, and 3, but that's going through the legislative process. So as of now, the job supports are only available in the ECF program. Let's see, is there any paperwork that we can help people get in advance of the PAE from a client's healthcare providers? Yes. Caroline, you want to answer that?
That's a great question. There's no paperwork that you need, but typically when you get connected with the AAAD or with your MCO, they're probably going to ask you for medical records. So if you want to just go ahead and be prepared, help make sure the process flows more smoothly, having those medical records ready can really help speed the process along.
Yes, I just helped a client with this very issue that didn't have access to medical records, and the AAAD would not schedule their PAE until they had both the income information and the medical records. And so you will need something that shows the diagnoses that you think qualify you for a PAE that'll put you on the choices program. So they don't have to be like certified medical records, but you just need to have medical records that would be enough to establish a basis to believe that you would qualify medically. As far as the financial, if you don't have access for some reason or you don't have income, there is a statement that you can sign that says, I don't have any income that I need to show proof for.
Yeah, that is an issue we've run into where there are requests for medical records, you should not have to submit your medical records or any financial information before getting a PAE test. You should be able to get a PAE test without those things. But it is something that folks run into sometimes.
Okay, will Medicare, let's see, I think that's, will Medicare cover durable medical equipment for a stair chair lift for a senior on a dual plan who is losing muscle in legs due to Charcot-Marie tooth disease? There are within choices, there is coverage for some durable medical equipment and for household improvements. So you would need to look at what choices group they would fall in and what the applicable limits are within that group. That's, if you want more help with that specific question, please reach out to us and we may be able to help.
Yeah, if someone is on Medicare as well as TennCare, their Medicare is going to be primary, so you may want to submit a new order with your provider, and you'd want that order to say, this thing is medically necessary for this person. If it has been denied by Medicare, you may want to reach out to Choices. Choices does offer some minor home modifications, so it's worth reaching out to them about, but it will really depend if they're willing to do that or not.
That's
The yellow.
that one we already answered.
Okay.
How do I refute an income eligibility changes due to DAC status from dual eligibility?
Oh, that's a tricky one.
That's one I would recommend. Call us, call our intake people.
Yeah.
Because that's gonna be pretty specific to what the income eligibility change and whether you qualify as pickle and whether they failed to notice that you are DAC.
I have a case like that right now, where a client is on ECF Choices as well as DAC. It can be very tricky when someone is eligible in two categories, because TennCare really only wrote the policy. They're thinking of someone who's only eligible under one category. You can only be eligible under one category at a time. And for particular categories of choices, for this client that I'm talking about, it's an ECF Choices case. It's frustrating because those rules can contradict and conflict, because the policy wasn't really written in mind with someone who may be in a more complicated circumstance.
Okay, this one is, what if the ability to do ADLs is impacted by mental health or substance abuse as opposed to a physical disabling condition?
Yeah, so you would just want to provide all of those relevant details that you can. It's really up to who's it's ultimately up to TennCare what the final PAE score is. That's a good question. But I would say, those are relevant factors that do impact people's ADLs.
I know mental health should.
One thing they ask on the PAE test about behavioral health, but typically they are usually asking about dementia for that particular point. But if someone is having behavioral health issues is something that they do specifically ask about. They don't specifically ask about mental health or substance abuse, as far as I know. Yeah.
See, confirm you said ECF Choices is for beneficiaries. No, ECF Choices is for beneficiaries whose intellectual or developmental disability was diagnosed before the age of 21.
Yeah. There are lots of folks who are older than 21 on ECF Choices.
Yes, yes. For those who are determined ineligible for Choices or ECF and still need support, what alternative recommendations do you have?
That's a really challenging one. I feel very personally frustrated very often because there are not very many good options. One thing you can do is reach out about the options program. The options program is for folks who don't qualify. They're needing a lower level of support than even Choices 3, which is the lowest level of support needs. It would be a lower level than that. So I have clients call me and say, well, I can feed myself and I can walk and I can get around, but I really need some help with housework. I need some help cooking, things like that. Those types of support needs would fall under options. options, you can call triple AD about that. The options wait list is about 3 years long. It's really, really long. So you might want to get on the options wait list. If that person is eligible for Medicare, I would pursue home health options through Medicare.
And of course, we always want to remind people that just because you may have initially been determined ineligible for choices or ECF, that we do appeals all the time. The first decision is not always the right decision. So, reach out for assistance. It may be that there's additional information that you could have provided about other needs that you have that could have qualified you, or TennCare may have done the math wrong if it's an income issue, or they may have worker error. So, if you feel like, if you look at the criteria and see you're not eligible, then you do have to look at those other programs like options. But if you look at the criteria and say, I don't understand why I'm not eligible based on this criteria, then please reach out to us, because the answer you get is not always correct.
That is true. You can always apply for choices again, especially if your condition gets worse, your physical disabilities become more challenging in your life. You can always apply again. You can also I've had clients get on by just being really, really persistent and going, I'm going to appeal this, I'm going to appeal this, I'm going to appeal this. And they sometimes get on that way. Like Emily was saying, it depends who does your test. And sometimes, especially for folks who are kind of on that edge of being eligible or not, these smaller things can really mean a lot. But that's where it gets into providing those details, making sure you have enough medical records. Those types of things are really gonna help aid with that.
Yeah, and there are because it's dependent on a PAE, which is a somewhat subjective test. We have had instances where clients have been screened out or refused a PAE when they really shouldn't have been. We've had clients who were told you don't qualify for choices because you drive. That's not correct. That's a determination that someone is making that's not found in the program guidelines. So, sometimes we do just have to push back on the PAE and request a new PAE, or file an appeal if they're putting requirements on that aren't part of the program.
A big thing you want to make sure of is that you actually got a full PAE test. Sometimes people are denied after their initial phone screening. That is not a PAE test. If someone wants a PAE test, they have a right to get one. That is in the contract of AAAD. They have to give you one if you want one. But sometimes you have to be a little persistent and say, I want this test. But and a good way to know if someone has had a full PAE test or not is you ask what the score was. And if they can't give you a score, that probably means they didn't fully complete the PAE test. So you wanna reach out about that. Persistence is key.
Absolutely, absolutely. Okay, well, let's see, does TennCare have a category to approve blind?
So for folks who are blind or visually impaired, I think I can't remember exactly what it's called. It's
age blind and disabled.
it's specific for folks who are if someone is blind or visually impaired, if there's a specific thing that I'm not remembering, but they can sometimes get on Social Security, and if they're on SSI, they should get on TennCare automatically under the SSI category. If they get on Social Security disability, they would wait 18 months or 2 years and then get on Medicare. For someone who is blind or visually impaired, the key thing there would be if they are able to get Social Security or not.
And blind or visually impaired may also qualify you for choices because of the assistance you would need based on that.
Correct. Yeah.
Okay, well, that takes us to the end of today. I hope that we were helpful, that this was helpful information. If you need more information, please feel free to reach out. My email, which is on the screen, is ejenkins@tnjustice.org, or you can go to our website, which is tnjustice.org, and there you can request information about the programs that we offer and about assistance that you may need. Thank you. Have a good day.